Welcome to SS2 Islamic Religious Studies. This lesson explores Islamic medical ethics, the principles that guide Muslims in decisions about health, medicine, end-of-life care, and the ethical responsibilities of medical practitioners. Islamic medical ethics is grounded in several core principles drawn from the Quran, Sunnah, and Islamic jurisprudence. The sanctity of life, hifz al-nafs, one of the 5 maqasid al-sharia objectives of Islamic law, is the preservation of life. The Quran states in Surah 532 that whoever saves one life, it is as if he has saved all of humanity. This principle makes the pursuit of medicine a highly valued religious act. Do no harm, la dara wa la dara. The Prophet, peace be upon him, said, there shall be no harm inflicted or harm reciprocated. This hadith is one of the most important principles in Islamic jurisprudence and corresponds directly to the medical ethics principle of non-maleficence. Necessity. Darura. Islamic jurisprudence holds that necessity makes the prohibited permissible. This means that when a patient faces a life-threatening situation, otherwise prohibited procedures or substances can be permitted for treatment. For example, the prohibition on pork-derived products does not apply when a pig-derived medicine is the only treatment available for a life-threatening condition. Healing is from God. The Prophet said, God has not sent down any disease without sending down a cure for it. This creates an Islamic obligation to seek treatment and develop medicine. Islamic medical ethics provides guidance on several specific contemporary medical issues. Euthanasia and assisted suicide. Islamic ethics family prohibits euthanasia, both voluntary, patient request death, and involuntary. The Quran, 429, prohibits taking one's own life. However, Islamic ethics distinguishes between actively ending life and withdrawing life-sustaining treatment when death is inevitable and treatment only prolongs suffering. The latter is increasingly permitted by contemporary Islamic scholars under specific conditions. Blood transfusion. Initially debated, blood transfusion is now accepted as permissible under necessity. Abortion. Classical Islamic jurisprudence generally permitted abortion before installment, which is held to occur at 40 or 120 days after conception depending on the scholarly tradition, in cases of necessity. After installment, abortion is treated as equivalent to homicide except when the mother's life is at risk. The majority of contemporary Islamic scholars permit abortion in cases of rape, fetal abnormality incompatible with life, or serious threat to the mother's health. Mental health. Islamic ethics fully affirms the reality of mental illness and the obligation to seek treatment. The Quran acknowledges grief, anxiety, and despair. Abraham, and Yunus, Jonah, both experience profound distress in the Quran. Seeking psychological therapy is consistent with Islamic teaching. Confidentiality. The Islamic principle of keeping others' secrets, Kitman al-Sa, supports the medical ethics principle of patient confidentiality. Islamic medical ethics gives patients important rights in their medical care. Informed consent. Medical treatment requires the patient's consent. Performing a procedure without consent is a form of harm prohibited by Islamic ethics. Patients have the right to full information about their diagnosis and treatment options, and to make informed decisions about their care. The right to refuse treatment. A mentally competent patient has the right to refuse medical treatment, including life-sustaining treatment. This is consistent with Islamic respect for human autonomy and dignity. Confidentiality. Medical practitioners have an obligation to maintain patient confidentiality. Privacy. Islamic emphasis on modesty, here, supports patients' rights to privacy and to have medical procedures conducted with appropriate dignity. Care during terminal illness. Islamic ethics emphasizes the importance of caring for dying patients, managing their pain, and providing spiritual support. The sunnah of visiting the sick Ziyarat al-Marid, is a highly recommended act in Islam. The Prophet said visiting the sick is a right of the Muslim over the Muslim. Medical ethics issues have specific relevance in the Nigerian context. Traditional medicine. Nigeria has a rich tradition of herbal and traditional medicine. Islamic medical ethics does not prohibit the use of traditional medicine. The principle that God has sent a cure for every disease applies to traditional remedies as well as modern medicine. However, Islamic ethics also requires that practitioners be competent and that they do not harm patients. Vaccination debates. Some conservative Muslim communities in northern Nigeria have raised doubts about vaccination programs, most notably the 2003 Kano polio vaccine boycott based on unfounded claims that the vaccine contained contraceptives. Mainstream Islamic scholars, including Al-Azhar, have consistently ruled that vaccination is permissible and strongly encouraged. The Sultan of Sokoto supported polio vaccination. The Islamic principle of preventing harm, Ladera, strongly supports public health vaccination programs. Healthcare access. Islamic medical ethics creates obligations not just on individual practitioners but on the broader community and governance structures to ensure that healthcare is accessible to all, reflecting the Maqasid obligation to preserve life. Female healthcare workers. Islamic ethics supports training women as healthcare providers, particularly for the care of female patients, in line with principles of modesty and dignity. Today we covered that Islamic medical ethics is grounded in ifs al-nafs, preservation of life, lodera, or do no harm, darura, necessity, and the belief that God sends cures for every disease. Euthanasia is prohibited, blood transfusion is permissible, abortion is generally permissible before installment in cases of necessity, mental health treatment is encouraged. Patient rights include informed consent, confidentiality, the right to refuse treatment, and dignity. In Nigeria, mainstream Islamic scholars support vaccination and expanding healthcare access. For your essay exercise, explain how the Islamic principle of darura, necessity, can be used to justify medical treatments that might otherwise seem contrary to Islamic law, giving at least 2 specific examples.